Dear friends, let us now examine the signs and symptoms of cancer of the cervix. So we are going to examine this by answering the question which says, how do you know that one has cancer of the cervix? That's how we are going to uh, approach this next topic by addressing this question, sign, symptoms. That's how we are going to know if somebody has a cervix, the cancer of the cervix. So a woman is standing, the uterus is in the pelvic area, the vagina is below, and external genitalia is here. In normal circumstances, when you look inside the vagina, you see the cervix here. The cervix is normal. It's pink. It is smooth. It doesn't have any irregularities on it. That's how it is looking like in normal circumstances. But because the cancer will evolve in a very silent mode until it is at advanced stage, some women would be having these lesions without knowing that they have. You see, early stage, there is already something like a wound. You know how it looks like. This is the one, and they're showing us when you look from inside. And as they are progressing, this is how it keep on progressing, invading other places. We remember, we saw that there are cells that are multiplying in a very high speed in abnormal way. And these cells will be very bad cells. You see, now, the challenge that we have, the majority will not have any symptom. That's where the complexity is, the complexity of this problem. The majority will be, walking until on a later stage they start seeing signs. They start seeing, signs coming outside, and now they start complaining. I have this problem. Hmm? So, what will be the issue? They start maybe feeling pain, a little bit of pain, or they start seeing blood, vaginal bleeding after intercourse. Why? Because on those cells on the cervix which are abnormal, once the penis touch them, because they are too friable, they are too soft, easy, and now it is already at advanced stage, the woman would tell you, I bleed always after having sexual intercourse. And this bleeding is away from menstruation. She's not in menstruation, and from nowhere the blood comes. We need to note, not all the vaginal bleeding are due to cancer. There are other causes of bleeding, including infections, other infections, including fibroids, including hormonal problems, polyps. There are many causes. But now, since we are addressing the cancer of the cervix, if the penis will touch those cervix, which are, those cells which are already damaged, they start bleeding. You see, this like for this region, for example, that they're showing us, you see on the cervix, this in the vagina here. Now you can see if this one, it's like a wound actually. It's like a wound on advanced stage. Anything that would touch there, it will cause bleeding. So that's the cancer which is advancing. Other signs, we might have watery blood discharge. You see some fluid coming out, mucus mixed with blood, and most of the times they are smelling very bad. Why do they smell very bad? Those cells, they are so friable that bacteria will also penetrate in them and start multiplying inside. So wherever bacteria are, things will get rotten. It's like a rotten stuff, and they will smell very bad. So people who have this problem, ladies who have this problem, should not delay to consult. You don't delay. Hmm? There is nothing to hide. When you have a problem, you hide it. It keeps on harassing you. It keeps on burdening you for no reason. While services are available, it's good to consult on time. Pelvic pain during intercourse, can have pain during sexual intercourse. Then if you have, if you experience any unusual sign or symptoms that worry you, very important to run first to the doctor. Consultation, very important. You need to have your doctor and you have your screen done. Even before, we will see when to screen, when to start screening. We need to see it. Other places like in America, they chose to start between 13 to 15 years. They start teaching their teenagers on sexual activity in order to prevent that HPV that we saw, part of the causes, human papillomavirus. So we need to be careful and apply what we study. So now, when we start now these signs and symptoms, how to know if one have a cancer, there are 4 stages that we need to know. The stage 1 is when the cells are still only on the cervix. Then stage 2, it is approaching now the pelvic wall on the lateral and the left side, left and right, or it can come to the third of the vagina. Actually, it is upper third because it is near the cervix. Then it can also on the stage 3, it will progress going upwards to the kidneys, because the tubes that come from the kidney, the ureters, are too narrow. If the cells have been now invaded by the cancer cells, eventually they will block. If they are blocking the ureters, urine will not come out. If they don't come out, the urine will swell, will make the kidneys to swell, because the urine have no place to go. Or this will come with a renal failure, with very severe infections. Remember, those are the toxins that are supposed to be coming out. Then you can start seeing also the cancer to the lower part of the vagina. So which means they are busy expanding now. They are running in many different places. Then stage 4, they run very far. They run very far to the bladder, to the intestines. They can go to the bones. They can go to the lungs. The cell, as long as that cell have shifted from the primary location to other area. So these are the stages they are showing us. The stage 1, early stage, which is very easy, early, it can be detected, it can be treated. But now, when it is progressing to late stage, the whole cervix is covered, is damaged. Now the next after this stage is to spread into different places. Papa Nicolau, the man who discovered the test that is done, which is very helpful, which you call Pap Smear. Pap Smear from his name, Papa Nicolau, or doing what you call liquid-based cytology, where they take a liquid which is very specific, they put on those cells. If they change the color, you know these cells are already cancerous. They are not normal. Then they take a big sample, a tissue to go to examine under the microscope. That's what you call testing endocervical and exocervical sample. You take a big sample, a tissue, it's a zone, they call it transitional zone, then they go, they do examination. So this is one of slide showing us how to do Pap Smear. Your woman is in the totemic position on a gynecological examination table. You put speculum in the vagina, then you take a swab, which is designed to take that sample on the cervix. Then you put it, this is the cervix they're showing us. They take from inside the entrance of the cervix, they put on a slide. Then they take it to the laboratory. They tell us, are the cells normal or abnormal? Then they will tell us, if it is normal, eventually we won't see any problem. Early stage, they will tell us CIN, low grade. If it is high grade, they will tell us. If it's already cancer, they will tell us as well. So after this stage, you need to start the treatment plan. So this, again, the picture showing us the uterus, the vagina, and the cervix, where it shows already advanced. It is advancing because it has already invaded a big tissue. In a very short time, it will come down to the vagina if nothing is done. So the microscope would show a cell that was normal. You see, a cell is normal with a nucleus, which is one nucleus. Sometimes a cell will be like a crazy cell. You start multiplying, you start having two nucleuses, so they multiply in high speed. To understand this, imagine this cell has to divide and give maybe 10 cells in 1 hour. This one, in 1 hour, instead of giving 10, it will give 100. So you can understand now, they won't have a space to be. They will be like tumor masses. Thank you for following this presentation again. We are going to follow up with another short presentation on the complications. You know, what are the consequences if it is not diagnosed on time, if it's not treated? Then we'll end with the treatment. Thank you for following, and I believe it is bringing some light. And if some questions rises, please ask. You are welcome to ask any question. We'll help each other. Thank you.